The story of UK privatisation began with gusto under Tory governance, particularly during the Thatcher era from 1979 to 1990. It was presented as a revolution. The promise was one of efficiency, competition, and a new era of popular capitalism. Ordinary people, it was said, would benefit from share ownership and better services. Over 40 state-owned businesses, employing a vast workforce of around 600,000 individuals, were transferred into private hands. This included giants in energy, like British Gas in 1986 and electricity in 1990. The sell-off also encompassed vital industries such as railways, coal and steel, fundamentally reshaping the British economic landscape for decades to come. This monumental shift was driven by an ideology. This ideology championed the private sector as inherently superior to state control. The argument was that market forces would drive down prices. They would also improve quality and foster innovation. For workers, the narrative was often one of empowerment. They were told they would become stakeholders in the companies they worked for. The vision painted was of a dynamic economy. In this economy, the dead hand of the state was removed. This would allow businesses, and by extension their employees and customers, to flourish. The scale of this transformation cannot be overstated. It was a complete rewiring of how essential services and industries were managed and perceived. However, as the dust settled, questions began to emerge. Did these privatizations truly deliver on their promises for the ordinary worker? The initial gloss of wider share ownership soon faded for many. The focus shifted to the tangible impacts on jobs, wages, and the very quality of services that people relied upon daily. The grand experiment of privatisation set in motion a series of consequences. These consequences would be debated and felt for many years. The initial optimism for some gave way to a more critical examination of who the real beneficiaries of this sweeping policy truly were, particularly within the workforce. The narrative of universal benefits started to fray at the edges quite quickly. While some individuals did profit from shares in the short term, the longer-term effects on job security and working conditions became a growing concern. The transformation was not just economic, it was deeply social. It affected communities that had been built around state-owned industries. The promise of a more prosperous and efficient Britain through privatisation would soon be tested against the lived experiences of countless working families across the United Kingdom. The debate over its legacy continues to this day, a testament to its profound and often divisive impact. The privatisation of the energy sector serves as a stark case study. Consider the impact on employment. Between the early 1990s and 2001, a staggering 60% of jobs in the energy sector vanished. These losses were attributed to so-called efficiency gains, outsourcing, and general downsizing by the new private owners. For thousands of workers, the promise of a brighter future under private ownership translated into redundancy and uncertainty. Families and communities reliant on these jobs faced immense hardship. The drive for profit, it seemed, often came at the direct expense of the workforce that had built and maintained the industry for generations. This was a brutal introduction to the realities of a market-driven energy system. Then there is the issue of cost for consumers, who are, of course, predominantly workers. Far from delivering cheaper energy, privatisation saw bills soar. Between 1996 and 2018, energy bills for households increased by a shocking 50% in real terms. The energy crisis that gripped the nation in 2021 pushed this further, with gas prices skyrocketing by 250%. This has had a devastating impact on ordinary people. As of 2023, an estimated 3 million individuals in the UK were living in fuel poverty. This means they were unable to adequately heat their homes. The essential service of energy became a source of deep financial anxiety for many working families. While workers faced job insecurity and crippling bills, private energy firms reaped enormous rewards. Corporate profits reached record highs. For instance, National Grid paid out a colossal £1.4 billion in dividends to its shareholders in 2021. Around the same time, BP saw its profits triple to nearly £7 billion between 2021 and mid-2022. This stark contrast between the fortunes of energy giants and the struggles of ordinary people fueled widespread anger. It also raised serious questions about the fairness and the sustainability of their privatized model. The wealth generated was clearly not being equitably shared with the workers or the consumers who depended on these services. Adding insult to injury, when some of these large private energy firms teetered on the brink of collapse, it was the government, and therefore the taxpayer, that stepped in with bailouts. These interventions cost British consumers, the very workers already struggling, an additional £2.7 billion. Over 30 energy suppliers have collapsed since 2021 alone. The case of Bulb Energy, bailed out at a cost of £246 million to households, is a prominent example. This pattern suggested a system where profits were privatised, but risks and losses were socialised, falling squarely on the shoulders of the general public. The National Health Service, a cherished public institution, has also experienced the creeping influence of privatisation, raising profound concerns for workers both as employees and as patients. A comprehensive review published in The Lancet in 2023 found a worrying correlation. Increased privatisation often corresponded with worse health outcomes for patients. The late Professor Stephen Hawking himself warned that a move towards a US-style system, heavily reliant on private insurance, would inevitably create a two-tier service. This would disadvantage poorer workers, limiting their access to quality care. Private firms driven by profit motives may also cherry-pick profitable services, leading to disruptions and gaps in comprehensive care for everyone else. Another significant issue is the lack of transparency inherent in private sector involvement. Private companies are not typically held to the same exacting standards of public accountability as public bodies. For example, they are often not required to publish detailed accounts. This opacity can breed concerns about cronyism and questionable dealings, particularly when public money is involved. The COVID-19 pandemic starkly highlighted these issues. Billions were spent outsourcing services like testing and PPE procurement to private firms, sometimes with little oversight or proven expertise. This raised serious questions about value for money and the prioritization of public health over private profit during a national crisis. The impact on service capacity and staffing within the NHS is also a critical concern for workers. The number of available NHS beds in England more than halved, plummeting from around 299,000 in 1987/88 to just 141,000 by 2019-20. This drastic reduction directly affects the health service's ability to cope with demand, impacting workers who rely on it. Furthermore, NHS England currently faces a severe staffing crisis, with approximately 100,000 vacancies, including a desperate shortage of 32,000 nursing posts. This not only compromises the quality of care that workers receive, but also places immense pressure on the remaining dedicated NHS staff, leading to burnout and further departures. While advocates of greater private sector involvement argue it could offer patients more choice and potentially reduce lengthy NHS waiting lists, which stood at a staggering 6.4 million people, waiting for 7.5 million procedures in early 2024. The evidence for superior efficiency is debatable. International comparisons often indicate that publicly funded and run health services are more efficient. The United States, with its predominantly private insurance-based system, spends significantly more on healthcare per person than any other developed nation, yet often with poorer outcomes. Public trust also tends to be higher in countries with government-controlled systems like the UK's NHS, a service built on the principle of care for all, not ability to pay. The consequences of widespread privatisation, particularly in essential sectors like energy and healthcare, have not gone unnoticed by the British public. There is significant and growing discontent with the outcomes. For instance, a clear majority of the UK population, around 66%, now supports the nationalisation of the energy system. This indicates a widespread belief that the privatised model has failed to deliver affordable and reliable energy for ordinary people. This public sentiment reflects a desire for greater public control over essential services, ensuring they are run for public good rather than private profit, a direct challenge to decades of privatisation policy. In response to this shifting public mood and the evident failings of the privatised energy market, there have been some tentative recent moves towards greater public oversight and control. In 2022, the government announced plans to bring a division of National Grid back into public ownership from 2024. This new entity, the Future System Operator, is tasked with managing the nation's energy grids to help meet crucial net zero targets. Furthermore, the new Labour government, elected in 2024, has pledged to establish Great British Energy, GBE. This is envisioned as a public investment mechanism aimed at boosting renewable energy production and ensuring energy security. Trade unions have also been vocal in their critique of privatisation and its impact on workers. Unions like Unison, representing many public service workers, advocate for the nationalisation of the big five energy retail companies. They argue this move would not only help stabilise prices and improve service, but also transfer over 34,000 workers into more secure public service employment. This perspective is echoed by many frontline workers, such as senior nurses in the NHS. They argue that privatisation under successive governments has systematically led to underfunding, chronic staff shortages, and ultimately compromised patient care, harming the very workers who depend on these vital public services. In conclusion, the great experiment of UK privatisation under Tory governance presents a mixed and often troubling legacy for ordinary workers. While proponents initially promised increased efficiency, wider choice and economic dynamism, the reality for many in key sectors like energy and healthcare has been job insecurity, stagnant wages, and a decline in the quality and accessibility of essential services. Meanwhile, corporate profits in these privatized industries often soared, and the public frequently bore the cost of bailouts. The growing public support for renationalisation suggests a deep-seated belief that privatization has, for many workers, proven to be more of a bane than a boon, prompting a crucial debate about the future direction of Britain's public services.